The House of Commons and the Senate are expected to discuss amendments this week to the government's medically assisted dying bill, an issue that affects many Canadians. With me now is Dr. Naheed Dosani, who will be testifying this week, sharing his perspective as a palliative care physician. Doctor, good morning. Glad you could be with us. Let's just talk, first of all, about why this issue is so important to you.
As a palliative care physician who provides health care for people who experience vulnerabilities like poverty and homelessness, the new Bill C7, medical assistance in dying discussion, is really relevant to me. It takes away the clause around prognosis, meaning that people don't have to have a limited life expectancy. And I work in a world where basically you can organize medical assistance in dying in 2 weeks for a person, but it takes them years to get housing, months to get mental health, and months to get income supports. And that's morally distressing for me.
Morally distressing. So what amendments would you like to see? What are your concerns?
My feeling is that I think of people that I've cared for, like Bob, who had multiple sclerosis and complex pain, was referred to our service. We treated his pain, we supported him, but due to his illness, he fell into a life of addictions, alcohol, poverty, and had no one around him. And he chose medical assistance in dying because he wanted to escape a society that didn't support him. Then I think of people like Mary, who had HIV, was on the brink of AIDS, and really wanted to die through MAID. We gave her housing, income supports, and psychosocial supports that she needed, and she chose not to pursue medical assistance in dying. I'm worried that people may choose medical assistance in dying because they don't have adequate social supports around them.
So it's not a one-size-fits-all approach here. So what now? What can you do with your position?
Yeah, what I'm calling for is just to say that the same energy that went into medical assistance in dying should also be put into adequate housing for all, pharmacare, upstream income strategies to better support Canadians across the board. And throughout the discussion around Bill C7 and MAID, we have seen advocates, particularly the disability justice community, say that these stories, these narratives are not reflected in the discussions that are happening at the Senate. I'm told that these stories are few and far between, but as a street doctor, I see them in my day-to-day practice. We need to talk about these narratives more, and we need to bring these stories to the forefront.
Do you feel like you're being heard?
I think in one hand, there was a great reaction to the op-ed that I wrote in the Toronto Star based on my testimony. There's been a lot of discourse in popular media about it, but you start to wonder, are decisions around medical assistance in dying being made by people who are from a higher socioeconomic background? Are we really listening to people who live on the margins? My fear is that those stories and those voices are not being heard. So we're not going to stop this discussion. I'm told Bill C7 will continue in one form or another, but this discourse is very important.
Doctor, thank you so much for taking the time to speak with us about something that is so important, not just to you, but to so many Canadians. Dr. Dosani, we'll speak with you again.
Thank you so much.